Hello, my name is Dr. H Rosselli. For years as a state policy analyst, I used data to inform decision-making in legislation. But like many of you, I found spreadsheets, line graphs, and dashboards helpful but frustrating. This video on the coronavirus showcases an innovative three-dimensional data visualization tool created by my colleague Martin Kagan. I am eager to share this because of its great value to senior policymakers, scientists, business leaders, economists, and researchers worldwide. It's clear the world has never experienced a pandemic like the COVID-19 virus, and never before have we been able to track devastating effects of this virus on a daily basis to comprehend the status locally and globally. Data dashboards like the one from the Johns Hopkins Coronavirus Resource Center have been produced where viewers can obtain updated information on confirmed cases, deaths, and recoveries using heat maps, data tables, and interactive line graphs. And with generous funding from the Bill and Melinda Gates Foundation, the Institute for Health Metrics and Evaluation at the University of Washington is using data from the World Health Organization, government agencies, and hospitals to produce projections on the number of hospital beds, ICU days, and ventilators needed. Many of these data representations are available individually by state or country, as shown on Bloomberg using IHME data. Although valuable, there are limitations to the most popular data representations currently available. Raw data, or tables of means and variances, are not as insightful when hierarchical data are encountered. The quantity of data that can be presented in a single image is limited. Sites attempting to track multiple countries or states are often hard to read and less likely to be interactive across time. And lastly, interrelationships between variables and data sets cannot be entirely presented with a single image. But what if a system allowed the viewer to simultaneously view asynchronous, multi-dimensional data in an interactive three-dimensional data visualization? Using a patented data visualization tool, DataCocoon LLC has developed a holistic ecosystem, allowing the viewer to see data literally, hence the name Before Your Eyes. This new system falls squarely within the cutting edge of big data analysis, as indicated in Philip Rossum's Best Practices report, along the axes of potential and commitment. The resulting data visualization tool brings out the relationships between different elements. It summarizes complex data with interactive visuals. It simplifies visualization without the loss of the many dimensions of the data, and at the same time, it offers an array of analytical tools. The system involves multi-dimensional visualizations, enabling viewers to view and interactively manipulate asynchronous data in and over time because the software allows rotation of these figures on a computer screen, allowing comparison of different branches and relative sizes. DataCocoon's primary focus is to demonstrate the dynamic rendering ability of such a system to visually portray complex data systems over a vast array of clustered, hierarchical-based, complex data systems in and over time, using our IP based on key patents covering aspects of the third dimension. This promising methodology has a wide array of innovative applications. Prior to the current health situation, Before Your Eyes has been used to portray the White House budget, climate conditions with CO2 changes, as well as international trade data, some of which are already available on this YouTube channel. For the past 6 weeks, DataCocoon founder Martin Kagan has been actively tracking confirmed COVID-19 cases, admissions, recoveries, and deaths, with renderings that are further ahead of what others are able to currently represent. He's making this same tool available to researchers to extend the reach and breadth of the current COVID-19 IHME data. As you can see, Before Your Eyes presents the data in a circular pattern, placing the data along a spine with elevations representing individual data points. The visualization is far more compact than a typical spreadsheet and allows data to be easily compared to one another over an extended length of time. Smaller branches can also be compared based on the pattern differences visualized along the central axis. Using visualizations like this also helps to detect data entry errors much easier than via a data spreadsheet. If the pattern is suddenly broken, then one can easily see that one of the numbers is incorrect. Like the individual data charts produced for countries or states, users of Before Your Eyes can track a multitude of dimensional attributes. In this case, admissions, beds, recoveries, deaths, etc. And as we see here in a line graph of Italy, showing deaths within shaded areas representing the lower and upper levels of a projected mean, our system also plots means as well as upper and lower bands simultaneously. Here we see the mean, upper and lower levels portrayed using 3 cylinders for the entire world. To better understand the data representations, let's consider data at the node level. Remember, the numerical count for the virus differs greatly across countries and/or states, so one must take into consideration the proportional factor relative to each area's population. For example, in these 4 states, there are differences between states like Maryland and Vermont. Within Before Your Eyes, the endpoint of a dimensional data tree, known as the leaf or node level, enhances the visual granularity by showing each and every element of data at the node for its axial point of representation in and over time. This ability does not distort data, rather it enhances the user's ability to interpret data. The system also allows projections to be defined, in this case for each country, using its own axial data, or as DataCocoon defines it, as proportional individual relative value. As seen here, the system is portraying multiple countries with asynchronous projections based on each country's axial point and reflecting their own virus data thus far and then projecting forward. When seen collectively, the data visualization might initially be overwhelming, but it is all-inclusive, and the viewer can effectively drill down on any dimensional data level. Here we are looking at actual admissions, past and present, as well as projected admissions for 29 countries, all based on IHME's dataset across time, January through August 2020. Similarly, for the United States, rather than viewing multiple data sets, we are able to view a 27 by 50 data array plus time, all in one structure. Much simpler than going through and viewing and comparing multiple data charts over time. At any stage, one can choose from a multi-level menu of data granularity enhancement formats. Here we see each region and respective states within one region at the node level over the set time period, and the calibration of the node is defined as its relative value of each data point in proportion to the highest and lowest data cell. So although New York and Delaware may appear to be of similar size, you are actually viewing the history of each state in and of itself. We thank you for viewing this video. For more details on the system, please view the Coronavirus COVID-19 USA case study and multi-day projections presentations on the website. We hope that this enhances our ability to understand and use data to address the world's most urgent issue facing all of us. We are in this together.